Good morning, everybody.
Good morning.
Welcome. There's something to be said for the fact that when times get tough, and times have been very tough, in the realm of providing mental health services and taking care of our constituents and taking care of the needs that we see up there, times are very tough. But there's something to be said about understanding that, but also understanding and realizing on a daily basis that the people that are building the bridges, who are beginning to work together, who are articulating exactly how important the needs are, who are putting a face to the issue, it's very, very encouraging to see collaboration and connecting and support for each other, whether it's members of the community, the mental health services community, or providers, supporters. Seeing people get together is where we need to be today. And although we faced a lot of setbacks over the last few years in terms of overall funding and attaining some of the goals we all hoped to attain, I think that it's important to remember we're still much further ahead in Massachusetts than we have been in the past. And I put that success at your feet and attribute it to the capacity for the community of folks who work together, not just individuals or small groups or advocacy groups or employee representatives, but the collaboration that has been happening over the last few years. The cross-pollination of ideas and motivation, and the ability to really support each other. Beginning to see things like more peer-led supports in communities, more comprehension of how important that is to those who are receiving services, to those who are providing services, and understanding that recovery in and of itself is a powerful, powerful tool. And, you know, again, we need money to provide a lot of the services, but we need to know here in the legislature, all of us, individual legislators, need to know about the peer-led efforts and the quality of the work that's being done and how important it is for folks who have a mental health diagnosis to have support, family, community, a sense of community, and the empowerment that comes with that enables far more people to be able to be here and put a face to the issue than I think we've ever have seen in the past. All that being said, the basic point I need to address in my daily work, you heard basically from my colleague, Senator Keene, who has, by the way, done an incredible job since he came in to the seat, and who I encourage all of you to get to know, because he's made a remarkable difference, not just in mental health, but also his grasp now of the role substance abuse and substance abuse, the lack of funding, the lack of programs has meant to all of us. So we've got some great champions here, but we know what we need are the dollars to continue the work that you folks have started. You know, you can't fund an idea that doesn't have a framework. You've given us the framework. Providers, constituents, people who are receiving services, you've helped to define the outline that we need to be following here. So I'm very grateful to have all of you here on many levels, but particularly because you're making the difference that will help us get to a point where we begin to prioritize services and funding for services on a much higher level than we have before. Again, thank you from the bottom of my heart. You've done an incredible job. Keep up the good work. Keep coming back here to the State House. Make sure that your legislators know that you care about this issue. Thanks again, and enjoy the day.